We know that this virus is here in our community through community transmission. We also know that the best way to prevent the spread is to social distance and stay at home. So that is why county leaders, along with our mayors of each of our municipalities, have collaborated to implement additional countywide restrictions in addition to the governor's statewide stay-at-home order. When we began discussing additional restrictions last week, we understood that there would be questions, and these measures would be difficult. The City of Wilmington was interested in putting in additional measures, and our Public Health Department provided them with a list of any and all measures that could be taken to help stop the spread. It was that guidance and those discussions that led me to speak with our other mayors, and we all agreed that we need a comprehensive approach. It was important that the restrictions put in place within the city were mirrored everywhere in our county. So our current order was based on on data and information from public health and specific knowledge about our community, that it is different from other areas, like our density and the fact that we live on the coast. So our countywide order was agreed upon by all of us so that we can have one approach, one voice, and be aligned in our focus of keeping our community and all of our residents safe. This order for the next 14 days is included and allowed by our state of emergency. Again, these measures are based on the advice and counsel from our public health experts. Because if we don't take these important steps now, it will be likely that this virus will have a devastating effect in the weeks and months to come. I'm especially appreciative of our medical community for your support of these efforts and for all you're doing to prepare and respond to this health crisis. Now I want to provide a brief outline of the state and county orders for all of you to hear and answer some questions that we may have heard over the past few days. I encourage you to visit our website that has a really comprehensive list of facts and other information. This website is health.nhcgov.com. Both the governor's and county's orders go into effect today at 5 p.m. The governor's order lasts for 30 days, and the county's order lasts for 14 days. We do plan to evaluate our local order, determine its effectiveness, and make decisions each week on how to best move forward. For the next 30 days, the governor's stay-at-home order requires that people stay at their residence and limit social interactions. If you leave your home, it must be for essential business purposes and essential activities like to care for others, obtain food, and seek medical care. There is a long list of what is an essential business, and I'm not going to run through that full list, but you can find it on our website on the frequently asked questions at health.nhcgov.com. The order also requires that people limit gatherings to no more than 10 people, which is something the county has had in place since I signed our state of emergency declaration on March the 20th. The order does not prevent citizens from being outside their homes to get fresh air, so I encourage you to take a walk while keeping 6 feet away from others. Play in your backyard, enjoy these pretty days, but enjoy them at your own residence. The county's restrictions take retail closures a step further than the governor's order to help protect our community. These closures are in line with the governor's order, and they are in line with many other largely populated counties in the state. The county's restrictions specifically close. Carry-out food service, but delivery, drive-through, and curbside food service is still permitted. It closes playgrounds, public gardens, team sport facilities, social clubs, and country clubs. It closes non-essential retail, but still allows for curbside retail service, so we encourage our businesses to adapt, be innovative, and think about how you can stay open with online shopping and curbside pickup. It's important to emphasize this point. All in-person shopping, except for those essential stores, needs to end. Our order also closes auto and boat dealerships, but not auto repair or maintenance services. It also closes hotels, motels, and short-term lodging that is less than 28 days. An important clarification is to make sure that if your business is listed as non-essential, but you're providing direct assistance to a governmental community partner, business partner, or nonprofit request for support in COVID-19 emergency response, you may remain open and operational. For example, if you're an auto dealership that is closed under the county's order, you're asked to remain at a minimal level of service so that a healthcare provider or local agency or business can purchase a van for transport if it is needed during this critical time. But you can't have your showroom open to customers. These restrictions on auto dealers and retail are similar to those in Mecklenburg, Buncombe, Guilford, and Durham counties. We are all trying to limit the number of times residents come into close contact with others or potentially contaminated services. Similarly, Hotels and motels are providing lodging for workers who are deemed essential and critical to our area right now, or providing lodging to residents who are displaced from their homes in New Hanover County, can continue operations as needed to support our community. The reason to close hotels is because we are trying to prevent vacationers and leisure travelers from coming into our community unnecessarily and potentially bringing the virus with them. But we want to ensure local residents who are otherwise displaced from their homes and workers who are in our community providing an important service continue to have a place to stay. The county and our nonprofits are also working with hotel partners to place our homeless or others who are vulnerable and living in congregate settings who are exhibiting symptoms and need to be quarantined, and that will continue to be essential. We know that it isn't easy, but these orders are meant to protect our frontline healthcare workers and our most vulnerable. But none of this will help if we don't take it seriously and obey these rules. Both the state and county orders are enforceable by law, but the legal penalties are not what should convince people to follow these orders. The seriousness of this virus and the fact that it is being transferred so easily from one person to another should make you want to comply. We hope and believe that you will listen. It is up to each of us to follow. We are a resilient community and we will get through this, but we have to do it together with our collective strength, kindness, and support. Now Lisa Brown will make a few comments from Public Health.
Thank you, Madam Chair. I couldn't agree more. Our message is simple. Please stay home. Don't travel unless it is absolutely necessary. And if you're experiencing mild symptoms, even if you're not in a high-risk group, please stay home. Even the most mild of symptoms that you have could impact someone else in a much different way. You have all heard it by now, but the best way to combat the spread of this virus is physical spacing, which is what we have all come to know as social distancing. There is currently no medicine in place, no vaccine for COVID-19. That means our actions must change to protect ourselves and to protect others. More aggressive measures now can help bend our local case count curve downward earlier and to a greater extent, and allow for a more manageable level over the long run. I also want to share that the state's Department of Health and Human Services is changing the way they confront this virus. And just this week, they've shared additional guidance with public health and clinicians that COVID-19 tests submitted to the North Carolina Public Health Lab should be performed only on those with symptoms compatible with COVID-19 and who are hospitalized patients, healthcare workers or first responders, patients who live in or have regular contact with a high-risk setting, and anyone at higher risk of severe illness, and whose results would inform clinical management. So that means that the way we as public health respond to our testing and monitoring of the virus is changing too. So if you have symptoms consistent with COVID-19 and your symptoms are mild, the best thing you can do right now is to stay home. Isolate yourself from other people in your household as much as possible and recover. If you have more serious symptoms or are at risk of serious illness and begin experience COVID-19 symptoms, call your healthcare provider or the coronavirus call center at 910-798-6800 immediately. More serious symptoms can include shortness of breath, difficulty breathing, chest pain or pressure, confusion, or blue lips. In the case of a medical emergency, please call 911. Public Health is actively working on behalf of our community. We are following and responding to the guidance from the state, and we are taking steps every day to help keep you and your families safe. We are all anxious during this uncertain time, but the only way we can stop this is to stay home. And we hope that you will all heed this advice. Protect yourself and protect our community. Our team has done a great job of providing really consistent, up-to-date information on our website. So please go to health.nhcgov.com to learn more and to stay informed.
And now we're going to address a few questions from the media and the community. The first question, how is enforcement going to work? Madam Chair?
Thank you for the question. New Hanover County Sheriff's Office, along with the police departments of the City of Wilmington, Carolina Beach, Curie, and Wrightsville Beach, have the tough task of enforcing the governor's order and the additional county restrictions. We know that this will be difficult and a strain on those public safety officers, so we're asking our residents to abide by these rules outlined. Keep the safety of these officers and the public at the forefront.
What can you tell us about the people out on boats, on private islands, and in the waterways?
We know that with the many beaches closed, that many of you are looking for ways to enjoy our beautiful weather and to get outside. And we've all seen the pictures of people gathering on the beaches. While the stay-at-home order and the county restrictions do not close waterways, we encourage our residents to be reasonable and responsible. Practicing the ordered social distancing guidelines, no matter where you are, is still critical for your health and the health of everyone around you. But really, if everyone, you could just stay at home.
The next question is, why did all of the municipalities and the county decide to issue more restrictions than the governor?
We're a highly dense community with 235,000 people who live in 199 square land miles. We also have open bodies of water, one hospital that supports a 7-county region, and a community that is different from other areas. It's so important that we work now to limit the impact on our hospital system so that they don't become overburdened and so that we keep our community as safe as possible. These additional restrictions are important and they're necessary.
The next question that we're getting a lot is, do people need a special permit to go to work?
No. You do not need a special permit to drive to work. Some local companies have given their employees documentation, but it is not required.
Something else that we get frequently is about the symptoms of COVID-19. So I'm 35 and I don't really fall into an at-risk category. So why should I be following these measures? Why is that important?
So one thing that we know is that no one has immunity and we have no vaccine. So even if you aren't in a high-risk category, you can still pass the virus on to someone else. And even though we have certain groups of people that we've deemed in high-risk categories because statistically they seem to be more likely to have severe complications, no one has a guarantee. And just because you don't fall into a high-risk category does not mean that you cannot have a severe disease and be harmed.
We have one question on Facebook about golf courses and why those are still permitted to be open.
So the idea is to promote social distancing as much as possible, while also to allow folks to get physical exercise in open spaces. And that's why the recommendation was to limit those activities that would make it harder to social distance, like riding together in a golf cart. And therefore, it was a restriction that was a balanced recommendation.
Is there any other message that you want to share with the community that you feel is important to make sure that they know as we go into these additional restrictions this evening?
One thing that I would like to just make sure everyone is aware of, up until very recently, we had reported out how many tests were pending within the county, and we were able to do that because at that time it was mandated that anyone that conducted a test, any of our local providers, had to provide that information to local public health. So we had a really good understanding of exactly how many tests were pending in New Hanover County at all times. That has since changed, and no longer are providers required to report that to us. Therefore, we don't feel confident that we have a full picture of what tests are pending, and that's why we made the decision rather to intentionally underrepresent that number, knowing the information was not reliable. We decided not to keep reporting that number out, knowing it was not the full picture.
And Lisa, that's part of the reasons we put in these additional restrictions, the mayors and us, because of the recommendation from healthcare professionals that we need to shelter in place.
Absolutely.
So The essential services came from a list that was asked by the health department and the county to put together. And I know people are upset about if they're listed or they're not listed, but the message here, everyone, is stay at home. Just stay at home and stay safe.
And we do have a few more questions coming in from social media. We'll ask just a couple more. In terms of the restrictions, stay-at-home order, is there a curfew in place?
No.
And then just a message of reminder not to hoard supplies. Is there anything you all would like to say about that? Is there any issue with the supply chain currently in our community?
To the best of my knowledge, there is not an issue with supply chain. However, please be mindful that not everyone in our community has the ability to go and purchase a month of supplies at a time. So please be cautious of that. Take what you need, but take only what you need for your household to be prepared, and make sure that others can do the same.
Yep. There's not a curfew. It just says stay at home. Thank you.
Thank
you,
you.
Lisa.